Thank you for viewing this demo of TRAKnet 3.0. My name is Dr. John Juliana, and I'm joined today by Dr. Alan Bass. Throughout the course of this demonstration, we're quite confident that you're going to see why TRAKnet 3.0 is really far more than just another podiatric electronic health record. We represent an electronic health record that is built specifically for podiatrists by podiatrists. As you will soon see, our mission is to create total solutions for all of today's challenges for our colleagues. In order to understand where we're going, it's valuable to talk about where we are today. We boast well over 2,000 clients nationwide, and that represents approximately 24% of the podiatric marketplace. Historically, we have enjoyed the highest percentage of successful attestations of all electronic health records. As your colleagues, we listen to what's important to you. As such, we're building upon our own reputation and not simply a reputation that we might have inherited. Clearly, TRAKnet 3.0 has differentiating advantages. It's a fully integrated charting, scheduling, and management platform made exclusively for podiatrists. We have a panel of podiatric experts as well as a user leadership committee made up of a number of key opinion leaders throughout the nation in the podiatry industry. We have refined the workflow in our software to be specific to the types of workflow that podiatrists utilize in their practice. The TRAKnet templates are comprehensively built towards the diagnoses that our colleagues see, and sharing those templates amongst each other is simple and seamless. A most unique characteristic of TRAKnet is found in the ability to customize the interface for each particular user. A front desk staff member can easily modify their view of the software to visualize only what's important to his or her tasks. The same applies to physicians and billers. TRAKnet has easy-to-use meaningful use and PQRS reports to help you monitor your progress and prevent costly penalties. And lastly, we strive to be far more than just an electronic health record vendor. We strive towards total solutions to the challenges that we're well aware physicians are facing today. We provide ongoing educational webinars and newsletters on practice management and other evolving changes in the healthcare environment. And in a few moments, you'll learn other optional and very cost-effective services that are designed for the total welfare of your practice. I'll be covering those solutions shortly. Very unique to the TRAKnet software is our trademark term practicization. The TRAKnet software allows our colleagues to virtually build the electronic health record that's important to them. While other companies build their model on a one-size-fits-all electronic health record, we allow clients to pick and choose the enhancements within the software that are not only cost-effective additions, but are most meaningful to their practice. This allows the typical TRAKnet client to contain their technology costs. These optional cost-effective enhancements include an integrated patient eligibility feature that allows the front desk to confirm the patient's insurance, their co-pays and co-insurances, their deductible, as well as the remaining portion of their deductible in real time. An advanced practice management reporting platform is another optional enhancement that can certainly optimize the management of practices both small and large, particularly those large group practices. There's also an optional TRAKnet patient portal that will allow patients to enter information into their private portal, all from the convenience of their home. And that information will then automatically populate the fields within TRAKnet. A cloud version of TRAKnet allows you to securely access your data from anywhere in the world that has internet. And a mobile app rounds out the optional enhancements that you can utilize to practicize your software. But we have far more available in terms of a multitude of other solutions to help our colleagues thrive. Our total solutions service line includes both TRAKnet billing solutions as well as TRAKnet consulting solutions. During a time that many physicians of all specialties are deciding to outsource their billing due to the rising complexity of this business process, TRAKnet Billing Solutions offers podiatric-specific and experienced coders and billers that allow a practice to stay focused on what they do best, patient care. Our services include all aspects of the revenue cycle management, including claims scrubbing, claims processing, submission, payment posting, appeals, and patient invoicing. We even take incoming patient calls regarding their outstanding balances off of your plate. TRAKnet Consulting Solutions offers you a very affordable access to a panel of experienced experts within the practice management world. Starting with our virtual practice optimization report card, you can begin to understand your practice's strengths, weaknesses, and potential missed opportunities. From that, plans can be developed to significantly improve your practice. Our services include business management guidance, staffing issues and training, marketing and practice development, cost containment strategies, as well as meaningful use and PQRS guidance. Before we move into a high-level demonstration of the TRAKnet software, there's only one last yet very important attribute that truly represents the value proposition of TRAKnet. Many electronic health records claim to be ICD-10 ready. Well, ask them what that means, and they'll tell you that it simply means the ICD-10 codes are part of their software. But TRAKnet goes far beyond being just ICD-10 ready. We even go far beyond providing simple conversion tools to translate your ICD-9 code into a generic ICD-10 code. These tools, unfortunately, will often fail to translate to the most specific level of ICD-10 and therefore will ultimately create claim rejections as well as an ominous cash flow crisis. Embedded into the TRAKnet 3.0 software is a patent-pending ICD-10 solution known as the Smartsheet 10 technology. This innovative software is not simply a conversion tool, but it represents a true solution that will ultimately give you the most definitive ICD-10 code and auto-populates the invoice within TRAKnet. Unlike many other ICD-10 tools, the Smartsheet 10 technology works through simple color-coded clicks. It contains alerts when a unique seventh character is required to prevent the claim from being rejected. It dual codes both ICD-9 as well as ICD-10 codes, which then allows the biller to choose the correct code based upon the date of service or the insurance carrier. And most importantly, the Smartsheet 10 allows for quick and simple creation of provider-specific superbills which contain each provider's most commonly used diagnosis codes. These providers can then use this superbill, which leads to the fully functional technology. So as you can see, we strive to be far more than just a podiatric-specific electronic health record. We strive to find total solutions for our colleagues to help their practices thrive during these challenging times. And now that you understand the fundamentals of our software, I'm going to turn this over to our medical director, Dr. Alan Bass, to give us a high-level glimpse of the TRAKnet advantage.
Thank you, John. Beginning with the next slide, after logging into TRAKnet, which is shown here, you will see a high-level look at TRAKnet. At the conclusion of the live demo of TRAKnet, you will see a demonstration of Smartsheet 10, our patent-pending total solution for ICD-10.
When logging into TRAKnet for the first time, you will come to a blank patient's chart. Before we begin with the full demonstration and the patient charting, let's talk a little bit about the settings that you would be able to change within TRAKnet. Begin by clicking on the username. From there, you can change the personal settings that you would have for yourself within TRAKnet. This is also the area where you can manage your templates, changing your passwords. You can also manage your printers from here, manage the use of any custom fields that you want to create here, and also configure the direct email account for Health Vault that is integrated in TRAKnet. Let's take a look now at the scheduler. By clicking on the scheduler screen, this is the area where all patient information can be done. The other tab that I want to draw your attention to here is your inbox for your Health Vault or direct communication. The tasks that are assigned within your office are listed there. The next tab down are your properties and any specific properties to the use of TRAKnet. Your e-prescribing tab that's here, where all of your e-prescriptions will be coming in for your refills. Your billing dashboard here, where you would handle your billing information and the sending and reconciling of claims. Let's come back up to the scheduler. Here is the place where you would make your appointments and also where you can also take patient information. You can click on to add your new patient information from right in this location. You can also enter the information while taking an appointment. In this case, let's show you how to add an appointment to TRAKnet. You'll click on adding an appointment and then searching for a patient's name. In this case, we're going to search for and choose Mr. Bob Test. Once we choose Mr. Test, we can choose the type of appointment that Mr. Test is coming into your office for. You can also edit the length of time that's needed for this appointment. It will default to what you preset. Clicking Save will enter Mr. Test into the appointment slot that you've chosen for him when making this appointment. In addition to scheduling patient visits, you also have the ability to schedule facility visits for those providers who are going to see patients in a facility. The window appears the same, but you're not going to be adding specific patients to the schedule the same way, but scheduling the patients directly from a recalls list where you can recall a patient for a specific facility based on the number of days or even based on specific diagnoses. You can set this up whether it's a facility or if it's even for specific patients within your office. You can change to the reason that the patients are being scheduled, in this case for a facility, and you can see that I have defaulted 2 hours needed for any facility visit. The patients that would be here wouldn't be listed individually, but would be listed specifically under that facility visit. In addition, you have the ability to edit and add in any type of an appointment that you would like to have defaulted in your system. You can have them be any length based on what you have in your practice as the interval. In addition to a day view, you can also have a list view for your patients that would have some more information based on charting, checking in, checking out. So if that is something you prefer, that view is available to you as well. By clicking on the patient's name, you can see that a very small snapshot of this patient appears on the bottom of the screen. You would have the ability from this very simple button to do integrated insurance eligibility in real time. You'll also know if the patient has a copay and be able to take the copay directly from this screen and have it go into your invoice. Let's click on the patient's name, which takes us directly into the patient's chart. From here, we're trying to go and show you all different things that you can do right from this screen. You would have a list of all of the patients that are scheduled for that day right there at your fingertips without having to click back on the scheduler. We have an integrated webcam where you'll be able to take a photo of the patient and add it to their chart. Clicking on demographics, you'll be able to edit and enter any information that's necessary as it pertains to your patient directly from the demographics screen. Moving on, let's take a look at the next button. The medications and allergies button will be where you can take a patient's medications and allergies history. By clicking on Add, you would be able to choose from a list of favorites that are here, also searching the LexiComp database as needed to find, and we are integrated with SureScripts as Pharmacy Benefits Manager so you can search for patients' medications that have been filled in a pharmacy. You would then be able to add it to the bottom of the screen, which would then be part of the patient's medication history. Adding in your allergies is a simple process by clicking on the Add button and being able to add your allergies from a list of favorites or from the LexiComp database. Moving on to your problems and diagnosis screen, clicking on that button will bring you to an area where it will list all of the patient's active problems. You can search for any active problems and add them to the patient's history. It will show both active and inactive problems that the patient may be treated for. Moving on to the next button is where we can electronically prescribe prescriptions for the patient. This will be the area where you see anything that has been listed, and by clicking OK, will take you directly into the e-prescribing platform. Moving on to the alerts button, you have the ability to add in any type of an alert that you wish. It is completely customizable. That is something that you would want to have show up each time you enter into the patient's chart. The next button over is where you would place any radiology, pathology, or lab orders that would go into the patient's chart. The next button down will be the Actions button, where other functionality such as importing documents, listing of pharmacies, any referrals that were needed to be sent, and a summary can be printed of the patient. Let's move over to the next row of tabs. Let's look at the workspace. The workspace opens up the very customizable dashboard, where this dashboard can be for anyone in the practice. And we'll come back to that in a moment. The multimedia tab is where you can scan and where all documents are housed. The billing tab is where all the billing information is entered for the patient. Entering in of the patient's insurance information, entering or viewing their ledger, the ability to view statements and send statements directly from here, the entering in of authorizations, and any remarks needed. Any progress notes that have been completed in TRAKnet 3.0 will list right on the left-hand side, and with a very simple click of the button on the specific date, we'll view it in the large pane. Any phone messages that are taken in regards to your patient would be found under the next tab. Your secure messages that are sent to your patients through Microsoft Health Vault are found under the Secure Messages tab. And for users that were previously done in TRAKnet 2.0, those encounters will be found under the Encounters 2.0 tab. New users of TRAKnet 3.0, of course, will have nothing listed under there. Let's go back over to Workspace and take a look at that. The Workspace is a very customizable dashboard depending on who is working within TRAKnet. They can have a view that is relevant only to their job description. In this case, was a look at a physician dashboard where the physician takes specific or wants to look at specific information. They may have information that is only relevant to things that they want to see. Looking at a billing dashboard, they may have information that is only relevant to billing information, such as primary or secondary insurance. A medical assistant may have a dashboard that has information that is relevant to their job description. You can edit these dashboards, and these dashboards are completely customizable by adding in specific links that will bring information directly onto the dashboard. The links that are entered onto your dashboard from the right-hand side are broken down into different fields, whether it's patient information, whether it's information that needs to be placed in regards to a patient's visit, whether it's billing information. These links that are placed within the dashboard are links that pull information from other areas of TRAKnet and bring them into the dashboard. You also have the ability to add in and manage custom fields where you can enter any information that you would like to track in your practice. Moving on, you can take a look at any other dashboard, and going back to the physician dashboard, you can see that the physician is able to have information that would populate in areas such as meds and allergies. These medications that you would be able to search for from the medications database, you can very easily get to directly from your dashboard. So there's really no need to go into another tab once you're viewing it from the dashboard. Once you click on that link in the dashboard, you're going to note that that information is brought directly from the medications field into that dashboard via the link that is placed there. The next tab over is the All Documents tab, and it is a place where any documentation that is done for the patient will be listed there, and you have the ability to view any information that's previously done within TRAKnet. Moving over to the right-hand side of the screen, you'll see some other information that can be taken here. You have the ability to take phone calls and messages for the patient that would then end up directly under the tab for phone calls and messages. Vitals that are taken with a single click of the button on that vitals. This labs button is for future use for meaningful use stage 3, where we will have integration with labs through the HL7 interface. All encounters and new encounter charting is done with a single click of the button, while printing of any forms or specific patient forms is done directly from this window right here. Moving on to the bottom of the screen, you'll note that a lot of information that you can take is done also from the bottom of the screen, and that information will populate your dashboard by clicking the buttons on the bottom or the button within the dashboard. You can populate this information. Let's move over and show a little bit about charting of an encounter for a patient. By clicking on New Encounter, that will open up the screen to either open up any existing encounters or the creation of a new encounter. You will have a drop down of all templates that are loaded into TRAKnet 3.0 for you to use. They are also going to be categorized into different body systems. You also have the ability to copy any old visits and use an old visit to a new visit. Let's take a look at a new patient SOAP template. Once you start that new patient SOAP template, you will see that certain information will already be populated into your encounter. The reason for that is exactly the same reason as the dashboard. Because there is a link in the encounter, it will pull certain information such as meds and allergies. By clicking on subjective, it will allow you to go to the subjective templates that will come preloaded into TRAKnet. These history of present illness or subjective templates will be able to be used for the most common chief complaints. Your objective templates listed under PE or physical exam are also broken up by body system, and those templates, through a very simple click of the button, will be able to be dropped into your template and dropped into your encounter for use for charting. We have for PQRS a full PQRS template library where all of the PQRS measures are here for you to use, and the documentation will go directly into your invoice. Your diagnosis tab will have the ability to search for any ICD-9 or search for through any of your favorites that you've previously created. We also here have our Smartsheet 10 technology preparing you for ICD-10. Clicking over onto the invoice screen, you will see that any of your charges are here. I previously embedded into my new patient SOAP template an initial office visit So you can see that the new E&M code is going to be listed here for you, and it will not have to be entered in since it was preloaded. Using the drop down, you can then edit that charge and enter in any of the diagnosis codes and connect them. You also can then edit or change any previous insurance information that was entered for the patient. Specific details that may need to be entered, such as prior authorizations, is done directly from the claim details screen. An initial scrubbing of the claim is done directly in the claim check window. It will tell you if any corrections need to be made. Any history that the claim may have from any prior submissions would be listed here under the claim history. Any payments that are made on the specific invoice would be listed directly under any charges that are made for that patient. And in this window, you'll also see any history that has been made on any charges and any payments for this patient. Closing this encounter, just a few other places I'd like to show you. Clicking on the reports will be able to provide you with information on meaningful use, stage 1 and stage 2, and your PQRS report. Thank you very much for watching this demonstration of TRAKnet 3.0. This concludes the video presentation of TRAKnet 3.0. Please press the page down key on your keyboard to continue on to the remainder of the presentation and a demonstration of our Smartsheet 10 technology.
To begin using our ICD-10 Smartsheet 10 technology, please click on the Smartsheet 10 tab located on the top left-hand portion of your screen. Once you launch into the Smartsheet 10 technology, you will notice that the screen is divided into two halves. On the left-hand side of the screen, you have all of your ICD-10 codes in alphabetical order. And on the right-hand side of the screen, in numerical order by body system, divided into the 21 chapters for ICD-10. You will also notice that you have the ability to set up smart sheets or electronic superbills, since your ICD-10 codes are much more complicated than your ICD-9 codes, and your superbill would be too long to be viewed on paper and can be set up electronically with your ICD-10 codes. You'll also have the ability to convert from ICD-9 to ICD-10, as well as from ICD-10 to ICD-9. In the example below, I've typed in 825.25, which is the diagnosis code for a metatarsal fracture. You'll notice that directly below that, you will see the initial conversion of the code from ICD-9 to ICD-10. By clicking on the ICD-10 button, you will get all of the choices that you will need to have for this code. You'll notice on this slide that when you convert your code from ICD-9 to ICD-10, the Smartsheet 10 technology knows immediately whether or not that code needs an appropriate 7th character for billing. In this example, you'll notice that I chose the 7th character with the letter A, which gave me the code of a fracture of an unspecified metatarsal of an unspecified foot for an initial encounter for a closed fracture. And while the A would be a good code to use and would be good for an unspecified foot, you will also see that you have the ability to click on either the right foot or the left foot. It's very important that you choose a code that is green. If the code is not green, that is not the most specific code you can bill and will most likely incur a denial on your claim. In this example, you will notice that the black code on the bottom right side of your screen caused us to get a red code on the top portion. This shows that this is not the most specific code available and will most likely have you have a claim denial. It is very important for you to click until you get a green code, which will give you the most specific code possible. Thank you for taking the time to watch this demonstration of TRAKnet 3.0 and our Smartsheet 10 technology. For more information, please contact sales@traknetpm.com. Thank you very much.